This is 13.5 Respiratory Disorder Notes. The essential question is, what are the causes of common respiratory disorders and what are their signs and symptoms? First disorder is the chronic obstructive pulmonary disease, or COPD. Patients that usually suffer from COPD almost always have a history of smoking or other types of lung disorders like emphysema, chronic bronchitis. Some type of problem already pre-exists, and the last stage before death would be COPD. And patients with COPD have an extreme labored breathing or really, really hard time breathing, which is dyspnea, and it gets worse and worse and worse. As the name of the disease indicates, COPD, C stands for chronic, which means that it has been going on for a long time. Obstructive tells you that there is a blockage, the air is not getting through because there is a narrowing of the bronchial tubes. And then pulmonary refers to the lungs, and then it's the disease. And notice that pre-existing conditions such as emphysema or chronic bronchitis or even asthma, if it's been going on for a long time and it leads to some kind of infection, then it could lead to COPD. Coughing and frequent pulmonary infections are common because any time where you can't get air in or get air out, air is going to sit in your lung for a long time, and then it's going to be a good environment for bacteria or virus to multiply and create an infection. Hypoxic or hypoxia, it's a term meaning that your tissue is not getting enough oxygen. And the reason for that is because of the narrow tubes, the air can't get in. And it will eventually, the respiratory system will fail. And it is the major cause of death and disability in the United States. The emphysema is the only disorder that has a problem exhaling. Majority of the other lung disorders, the problem is getting air into the lungs, inspiration. But emphysema affects the alveoli, and what happens is that a healthy alveoli are pockets of circles, individual alveolar sacs. But what happens with emphysema is those sacs are broken up and it becomes one large structure. Okay? And so one of the symptoms or diagnosis for emphysema is when you go to the doctors and the doctor listens to your lung, it almost sounds like when you put add water to Rice Krispies, that crackling sound. That's what it sounds like. It's because the alveoli are basically cracking. And eventually because of the damage to the alveoli, you build up fibrosis, which are the scar tissue, and then it's going to make the lung lose its elasticity. And remember, one of the big thing about exhalation is that the lung is elastic so that when it stretches out, it goes back to its normal size. In emphysema, it can't do that. So one of the signs you look for in emphysema is a condition called a barrel chest. So what happens is because the air cannot get out of the lung, so it remains in there, so it's going to increase the size of your thoracic cavity. It's going to get larger and larger and larger because you're getting air in and not getting air out. Cyanosis is a condition. It is caused by hypoxia, which is lack of oxygen to blood, and you're going to have a bluish tint to your skin because, remember, low oxygenated blood has a bluish tint to it. Chronic bronchitis is caused by a prolonged infection. If you have a cold or a flu, some kind of upper respiratory infection that does not go away, can eventually lead to chronic bronchitis. Again, remember, chronic means that you've been sick for a while and it's getting worse and worse and worse. And bronchitis means inflammation of the bronchial tubes. Mucosa of these tubes become inflamed because of the microorganism that's causing the infection. And there is an increase in production of mucus, which means those mucus is going to pool in the lungs or in the airways, and then you're not going to have gas exchange in the alveoli because of mucus. If untreated, chronic bronchitis can lead to pneumonia, which can cause death sometimes in people that have a compromised immune system. A huge cause of respiratory disorder or respiratory failure has to do with tobacco use and living in an area where there's bad pollution or having an occupation where you're dealing with bad air like coal miners. So what happens is when you are continually breathing in these bad air, then you're going to get a irritation that's going to irritate the bronchial tubes and cause inflammation, which can, in the long run, cause a chronic bronchitis that's been going around for a long time. Or the breathing of these bad air can cause damage to the elasticity of the lung and the alveoli, which can then lead to emphysema. And these two diseases can then lead to an obstruction and difficulty breathing, and that's what we call COPD. And then eventually what can happen is a respiratory failure and death. Lung cancer is the third cause of all cancer death in the United States, and it is most commonly associated with smoking. And there are 3 different types of lung cancer. There are squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. Here is a picture of a healthy lung on the left. And usually when you feel lungs, it is almost feeling like spongy. It is very soft and squishy. On the right, you have a cancerous lung, and you can actually see the tumor right here. And when you actually feel a lung with tumors, then it's going to be a hard mass. You can completely see it. And so when you take a chest x-ray to look at the lungs, you're going to see an area of dark white area where the lung is because it's going to be a solid hard mass. Sudden infant death syndrome, or SIDS, is a diagnosis given to children under the age of usually 6 months or younger, and when there is no other cause of death, and they usually die in their sleep. And usually it could be due to the problem in the brain, either the medulla or the medulla oblongata or the pons. That could be the problem. Asthma is a very common disorder in people that live in California, and it has to do with living in an area with bad air quality. And it's an allergic reaction. What happens is that the air that you breathe, things in the air, dust, things like that, is going to cause inflammation of the bronchioles, and then it's going to cause coughing, difficulty breathing, and wheezing. Now, wheezing is a kind of a squeaky kind of sound that people make when they're breathing, and the reason for that is when the airway is closed off and you have a more narrower space, air passing through, it's going to whistle as it goes through. And people that have asthma are given inhalers, and what inhalers are is epinephrine, which is neurotransmitter, and what it does is it opens up the airways into a bigger area so they can breathe. So that's what the epinephrine does, is a vasodilator to the bronchial tubes. Cystic fibrosis is a genetic disorder, and it causes the baby to oversecrete mucus. Then that's going to clog up the airways, and then it's going to pool in the alveoli, and if the alveoli is completely filled with mucus, they can't do gas exchange, and so then the kid's going to have difficulty breathing, and it could lead to death. Age is a factor. As you get older, you naturally lose the elasticity of your lungs, which means that in the expiration process, you cannot get out. The lungs will not stretch back to its normal size and push the air out, which means the amount of air, the vital capacity, the total amount of air that you can exhale and inhale is going to be compromised. So that means you're going to have air remaining in the lungs. It's going to increase the residual volume, which means that's a place for an infection to occur. That could lead to chronic bronchitis or pneumonia down the line. The respiratory rates, like anything, newborns have the highest respiration rate, about 40 to 80 breaths per minute. And then infants were kind of decreased to 30, and then between toddlers are about 25. But by the time you hit adult age, the respiration is 12 to 18 or 12 to 20 is the normal respiration. And then anything above 30 would mean that you usually, when people are in shock or they're hyperventilating, then the number would be above 30. Now, as you get older in the elderly age, the rate could increase because now then they've lost the elasticity of their lungs and they're not moving as much air in and out, so they have to compensate for less air being delivered into the lungs and out of the lungs. They increase the rate in order to get more air in. 13.5 notes homework. Number 1, what respiratory conditions are the precursors to COPD? Number 2, what structure is destroyed in emphysema and what are its signs and symptoms? Number 3, why are elderly more prone to respiratory distress and diseases?